Everybody could use a little guided patient support getting through the healthcare maze. This video series is a roadmap that will give you a good understanding of how it all works. Welcome to your healthcare roadmap. We'll break down our seemingly complex healthcare system down to 5 key questions. Each question's important, and the valuable information you'll find will help you make informed decisions. What do I have? What do I need? Where do I go? What does it cost? And how do I connect? This video will focus on the question, where do I go? If you have a medical condition that's been diagnosed by your general physician, then your next step is likely to find an expert doctor. And perhaps you'll need to find an expert hospital to perform a prescribed procedure or treatment. Make sure you confirm that both your doctor and your hospital are experts in your condition. People tend to think of a doctor as having met certain qualifications, and therefore, they're all pretty much the same. But the reality is, just like any other profession, doctor quality varies from poor to excellent. What this means is that where you go for your healthcare really matters. Doctors are not the same. Just as all artists are not the same. And just like artists that paint what they are used to painting, doctors do what they are used to doing. And even expert doctors are better at some things than they are at others. For instance, a surgeon is a doctor that specializes in surgery. Surgeons have specific areas of expertise. You wouldn't want a hip surgeon doing your heart surgery. Are they an expert in your condition? Polling says that 83% of people believe that a doctor's overall knowledge, training, and expertise are very important. Yet, not all of us are comfortable asking our doctor about his or her qualifications. Did you know that you are more likely to have a better outcome with a board-certified physician? A doctor's education should never stop. Look to see if your doctor maintains board certification. This will let you know that they are keeping up to date. Yet, as many as 1 in 5 doctors don't. That one is somebody's doctor. If you've ever shopped for a car, there's a 42% chance that you spent 10 or more hours doing research. Yet, when it comes to researching your doctor, there's a 34% chance you've spent less than an hour looking into your doctor's background. It's important to ask questions. By asking questions, you'll get a sense of how well your doctor listens to you about your concerns. Another thing you should be researching is which hospital you'll be going to for your healthcare. Your hospital choice really matters, in much the same way that where you choose to have dinner really matters. It's all about experience. Just as with doctors, hospitals are different and have different strengths and weaknesses. When you're in a top-rated hospital, you are much more likely to avoid problems, spend less time in the hospital, and even more importantly, survive. The more patients like you that a hospital treats, the more experience they have, and the better your outcome will likely be. So, 3 things to remember. Neither doctors nor hospitals are created equal. Ask your doctor questions and look into his experience and reputation. Make sure you are comfortable. Last, investigate and ask questions about your hospital's experience and track record in the treatment and procedures for your condition. To learn more about the question of, where do I go? We have prepared a free guide that is filled with more detailed information on what to look for in your expert doctor and expert hospital, and links to reputable sites that will help you. In the description below, you'll find a link to go download. It's free.